Well, thank you very much, Mr. Chair, and I want to thank you and the ranking member for welcoming me to the committee. I am so pleased to be here, and I hope to work with you and Ranking Member Wyden and all the members of the committee on the full range of issues under the committee's jurisdiction, including on efforts to strengthen Medicare, Medicaid, and access to affordable quality health care. Obviously, lowering prescription drug prices is a big part of this, so I am very pleased we're having this hearing. And I want to thank all the witnesses for being here today, and to Mrs. Sago in particular. I know from personal experience how difficult it is to talk about one's children in public, especially when they need particular medical care or help. So thank you for being willing to do that, because you're giving voice to an awful lot of people, and we really need to understand your experience and the experience of people with chronic illness all around our country. So thank you for being willing to do that. Dr. Miller, I wanted to start with a question to you, really to follow up on something that you said in your testimony. We've seen a lot of bad actors gaming the system over the years, really to pad their pockets. There are countless ways drug companies take advantage of loopholes, and taxpayers end up footing the bill. I certainly saw that as a former governor. I know how hard it can be on states, especially when it comes to Medicaid. One way drug makers play games is with the Medicaid rebate program and the way they calculate rebates for what are known as authorized generic drugs, generic versions of brand drugs that the brand manufacturer itself produces and sells, which are typically less expensive than the brand drug. When this was first explained to me, it really made my head spin, and it still kind of does. Drug makers can take advantage of a loophole in the law that lets them include the less expensive authorized generics in the calculations of how much they need to provide in discounts for brand drugs under Medicaid. And oftentimes they do this selling their authorized generics at a lower price to their own corporate subsidiaries. Including these authorized generics in the calculation then lowers the amount in discounts the manufacturer needs to provide to Medicaid, meaning that the government ultimately isn't getting the full discounts they should, and neither are taxpayers, from the manufacturers. MACPAC has unanimously recommended that Congress fix this loophole. Now, I know, Dr. Miller, that your expertise tends to focus on the Medicare area, but I'm interested to hear your thoughts here. Do you think it's important that we prevent manufacturers from gaming the system, including fixing this specific issue?
I agree. Your head is, mine is too, on these behaviors. I do agree. I think I tried to address it in my testimony. Right. It may not have come across clearly, but yes, that misclassification of drugs is something that should be addressed, and I believe there's draft legislation floating around. Right. And that should be a step that is taken.
Well, I thank you for that response. And speaking of Medicaid rebates, I certainly know that the chair and ranking member have both been champions of fixing misclassification. So I'll be pleased to work on legislation around this issue and look forward to the committee's work to get it over the finish line. Dr. Miller, I also share another priority on drug pricing and healthcare costs more generally that I know both the chair and ranking member have also worked on, and that's the need for more transparency, and everybody's talked about that here today. While we know that transparency alone is inadequate to address high drug prices and other healthcare costs, we know that it can certainly play an important role. For example, we know that drug companies pay billions of dollars to physicians. Data gathered because of the Physician Payment Sunshine Act shows that in 2016 alone, drug and device companies paid more than $8 billion to doctors. These payments are in gifts, in meals, in travel, and speaking fees. Dr. Miller, I'd like to know what you think about these drug company payments and how they influence prescribing and ultimately how they might influence patients.
So I think we're talking about the Sunshine, or what's referred to, the Sunshine legislation. Back in the day when I was the executive director at MedPAC, we strongly recommended that and endorsed it, developed the design behind it that we put in front of the Congress. And so we think that there should be line of sight for drug and device companies, their contributions to physicians and other actors in the system. The one thing I would draw your attention to is payments to patient groups are not tracked as part of that and should be added.
Yeah, I thank you for that point, and I look forward to following up on it with you. Thank you, Mr. Chair.